Recognized.
Thank you, Mr. Speaker. This week in Congress, we passed 18 bills to address the heroin and opioid crisis that is impacting every community in this country. I'm thankful that my bill, H.R. 4641, which I worked on with Representative Kennedy of Massachusetts, this bill will ensure that healthcare professionals have access to up-to-date guidelines and best practices for treating patients with acute and chronic pain. Many of these proposals we consider this week enjoyed nearly unanimous support, and I can't express to you how refreshing it was to work with all of my colleagues on meaningful solutions to this public health crisis. As we learned from the multitude of members this week that shared their stories on the House floor, we're facing a public health crisis that crosses every socioeconomic, every geographic, generational, and ethnic boundary. It's a rural, urban, and suburban problem. It reaches into our schools, our places of work, our hospitals. It's tearing apart and devastating families and people's lives. However, in the midst of this crisis, as with many past crises faced by our nation, we as members of Congress have set aside our political differences and have crafted a package of thoughtful reforms that will support our communities ravaged by this scourge. I'm proud of the work done by the Energy and Commerce Committee and the strong bipartisan leadership by Chairman Upton and Pitts and Ranking Members Pallone and Green. We cannot overlook the hard work and countless hours spent by both the majority and the minority committee staff on this effort, and I want to thank them for their hard work. Members of the Energy and Commerce Committee have pursued answers to this epidemic through roundtables, meetings with individuals and families on the front lines of this crisis, health workers, first responders, and community leaders seeking to guide their communities through this crisis. We as members have visited neonatal intensive care units and hospitals to see firsthand the devastating effects of infants born addicted to opioids and who must already fight for survival through their withdrawal in their very few days of life. We've met with juvenile court judges, social workers whose caseloads have doubled over the past few years as more and more children are being removed from their parents' care because their parents are more concerned about where to find their next high than the welfare of their child, and it's no longer safe for them to remain in their homes. It's important to note that it's National Police Week this week, and it's our first responders who so many of us have talked to. Those we've heard from in Indiana, who keep naloxone in their police cruisers because they're seeing this unprecedented increase in drug overdoses, and they're saving lives each and every day. In a minute, my colleague from the Judiciary Committee will highlight all of the great work that their committee has also done to fight this scourge. But I'd like to take a moment to highlight the bills rolled into this legislation that my colleagues from the Energy and Commerce Committee have painstakingly crafted. The Opioid Review and Modernization Act, led by Representatives Maloney and Lance, would require the FDA to work closely with expert advisory committees before making critical opioid approval and labeling decisions, develop recommendations regarding prescriber education programs that address extended release and long-acting opioids, and encourage development and approval of generic opioids with abuse-deterrent properties. Representative Sarbanes led the Co-Prescribing to Reduce Overdoses Act, which would establish a grant program for co-prescribing of opioid reversal drugs for patients who are at a high risk of overdose. Representative Evan Jenkins and Representative Bustos crafted the Nurturing and Supporting Healthy Babies Act, which will expand our knowledge of care and treatment for babies with neonatal abstinence syndrome and fixes an unintended consequence within the Medicaid drug rebate program that discourages drug manufacturers from producing opioids that are harder to abuse. Representative Lujan led efforts to establish a pilot program that will provide grants to state substance abuse agencies to promote innovative service delivery models for pregnant women who have a substance abuse disorder such as opioid addiction. Representative Kinzinger's Veteran Emergency Medical Technician Support Act will improve the quality of care within our communities by providing grants to states with emergency medical technician shortages so as to help streamline state requirements for our veterans to enter the EMT workforce without there being an unnecessary duplication of their training. Representatives Meehan, Kind, and Veazey led the legislation directing the CDC to study what information and resources are available to youth athletes and their families regarding the dangers of opioid use. Lolly's Law, authored by Representative Dole and Representative Catherine Clark, would create a competitive grant program to help states increase access to the overdose reversal medications that save lives. The Reducing Unused Medication Act, led again by Representative Clark and Stivers, clarifies when Schedule II controlled substances, including opioid pain medications, can be partially filled. Representatives Foster and Pallone spearheaded the Examining Opioid Treatment Act, which requires the GAO to collect the data necessary to assess the opioid infrastructure in our country, looking at the numbers of hospital beds and treatment facilities. And finally, my Hoosier colleague, Representative Bouchon, along with Representative Tonko, championed a bill that will expand existing opioid treatment capacity substantially by providers, all while ensuring that the care that the individuals receive is high quality and minimizes the risk of diversion. Each approach that I've just set out has been a reflection of much effort put into crafting these bipartisan, thoughtful, and a comprehensive package to give each of our communities, families, and individuals with addictions the support they need. Thank you, and I reserve the balance of my time.